Good evening. So we can start the session. I think I am audible to everyone. 2 minutes more is there, so we can start the session after that. So we can start the session. Sorry for the inconvenience. Some network issue was there. We are going to start the session. So today is World Tuberculosis Day. World Tuberculosis Day 2024. So we aim to conduct this lecture mainly to focus the pharmacist, the role of pharmacist in the tuberculosis care and tuberculosis control. In order to emphasize that only, we are doing this lecture in World Tuberculosis Day. So coming to the introduction, as we all know, World Tuberculosis Day is March 24th. So it is commemorate to raise public awareness about the devastating health, social and economic consequences of tuberculosis, and to set up efforts to end the global epidemic, TB epidemic. And as we all know, Dr. Robert Koch, he announced that he had discovered the bacterium that causes TB on this day, and this day marks the day in 1882. We are celebrating it as World TB Day. So, coming to tuberculosis, first we need to know what is tuberculosis. In order to know about the role of pharmacists, first we need to learn about what is tuberculosis. Tuberculosis, as we know, it is a bacterial infection. It is an infection which is caused by bacteria, and it is mainly affecting in the lungs of the patients, and it can spread through air when the infected person either cough, sneeze, or spit. The thing is that tuberculosis, it is preventable and curable, and about a quarter of the global population is estimated to have been estimated with TB, and about 5 to 10% of people are infected with TB, and only a little when compared to that, the symptoms and development of TB disease is less. So coming to next slide, as we all can see, the tuberculosis, it mainly affect in the tracheal region, in the lungs region. So infection of bacteria is occurring. This is bacteria, it infects the lungs, and the characteristic symptoms of tuberculosis will occur. Coming to the common symptoms of TB, we need to know about the common symptoms of TB. Why? Because as pharmacists, we have an important role in screening the patients with TB. Once the patients are coming with these symptoms, we can diagnose them with whether they are having TB or not, and we can refer to a good doctor. So these symptoms has to be studied. The symptoms include prolonged cough, and sometimes there will be blood in the cough, which is followed by chest pain, weakness, fatigue, weight loss. Drastic weight loss will be there, fever will be there, and night sweats will be there. So these are the characteristic symptoms of TB. So a pharmacist should be aware of the symptoms so that he or she may be able to screen the disorder in patients. Coming to next, what are the diagnosis method which we can use for diagnosing the tuberculosis? We are using molecular diagnostic technique according to World Health Organization. We can use various techniques such as TrueNut assays, and also high diagnostic accuracy assays are there. Tuberculin skin test is there, or interferon gamma release assay is there. Then for multi-drug resistant TB, in order to analyze, in order to diagnose that, it needs so much complications. And also tuberculosis in children, it is difficult to diagnose. So mainly we are using tuberculin skin test or interferon gamma release assay. Along with that, ultra and troniate assay is also used. Coming to the prevention, following steps can be taken in order to prevent the tuberculosis spread. First is seek medical attention. If you have symptoms such as cough is there, or fever is there, or unexplained weight loss is there, then if these symptoms are there, we can seek medical attention, and also get tested for TB infection if you are at a risk. For example, if you are in your household, someone have the disease, or in your workplace, someone have the disease, then you can just get, you can just get the test. If the prescribed treatment to prevent TB, you should use that complete or full course. That is one another point what the pharmacist can emphasize, or pharmacist can emphasize to the can explain to the society, because the course of tuberculosis drug is highly essential. If it is meant to be taken for 2 to 4 or 4 to 6 months, it should be taken that duration. Otherwise, the patient will not get the proper effect. If you have TB, then practice good hygienic. That is, we all know, while coughing or while coughing, we should wear a very good mask, and we should cover the mouth and nose while sneezing, coughing, etc. And if sputum is there in the towels or something, you should properly discard that. So these are the measures that we can use to prevent the disorder. So diagnosis can be done and prevention can be done. Coming to the treatment of tuberculosis, we need to know tuberculosis is a bacterial infection, as we said. So it should be treated with antibiotics. And the recommended antibiotics for tuberculosis infection, it includes isoniazid, rifampicin, pyrazinamide, ethambutol, streptomycin. To be effective, these regimens should be followed for 4 to 6 months. And if it is dangerous, to stop the medication early or without any medical advice. This can allow the TB to come again, or the TB to recurrent TB occurs, and also multi-drug resistant TB can occur as a result of stoppage of drug before the course. And also, in some cases, the tuberculosis will not respond to the standard medication. That condition is known as multi-drug resistant tuberculosis, and extremely drug resistant tuberculosis is there. In that condition, we have to use certain second line drugs. So coming to the treatment, after the treatment, coming to the first line drugs, second line drugs, and novel drugs. A pharmacist or a healthcare professional should be aware about the various drugs that are used in TB. So TB is what? TB is actually, it is a bacterial infection that affects the lungs. Mainly it is affecting the lungs. And what it can be done by using certain treatment or certain drugs. It is curable in nature, or as a result of using it in a particular time duration for about 2 to 4 months or 4 to 6 months. Depending upon the drug, the duration will vary. If you are using the drug in that particular duration, we can cure the treatment. We can cure the TB. So it is treatable and curable. So in this slide, we can see the multi-drug resistant TB. It can lead to toxic side effects. And the first line drugs that are used for TB are rifampicin, isoniazid, ethambutol, pyrazinamide, streptomycin. The second line drugs that we are using are ethionamide, prothionamide, cycloserine, cherisedone, para-aminosalicylic acid, tiacetone, clofazimine, amikacin, kanamycin, capreomycin. So these are the second line drugs that we are using. Then besides this, novel generation of anti-TB drugs are also there, such as delaminate, then pretominate, then bedaquiline. These are the novel drugs. Then as a result of XDR, that is extremely resistant TB condition also, what happens is the patients will not respond to the first line therapy, especially to isoniazid as well as rifampicin. And also the second line drugs such as patient will not respond to fluoroquinolones, and second line injectables such as amikacin, kanamycin, capreomycin, the patient will not respond. So that condition is known as multi-drug resistant or extremely drug resistant tuberculosis. And this mainly occur if a patient is not following the correct duration to take the medication, or he is not completing the course. Then only this condition is occurring. So coming to the multi-drug resistant TB, you should know about, as a healthcare professional, we should know about the multi-drug resistant TB. It is actually a form of tuberculosis that is caused by bacteria, and it is a condition in which the patient does not respond to isoniazid and rifampicin. What is isoniazid and what is rifampicin? As we all know, they are first line therapy, first line drug. So the two most important first line drugs are isoniazid and rifampicin. In multi-drug resistant tuberculosis, the patient did not respond to these two drugs. So second line drug has to be used, and it has to be used extensive. These drugs are somewhat expensive or having toxic effects more when compared to that of first line drugs. So drug resistance emerges when TB medications are used inappropriately through incorrect prescription by healthcare providers, or poor quality of the drugs, or patients abruptly stopping the drugs prematurely can all leads to multi-drug resistant TB. So that is multi-drug resistant TB. So in some cases, more extensive drug resistant TB, it will take place. In that condition, the patient is not effective to the second line injectable preparations also. So accordingly, we have to prescribe the medications. Only about 2 in 5 people with drug resistant tuberculosis access treatment in 2020 as per the statistics. And in accordance with WHO guidelines, the detection of multi-drug resistant as well as rifampicin resistant tuberculosis, it needs bacteriological confirmation of TB, and also it needs the testing of drug based upon various molecular tests and cultural analysis. So this is known as the multi-drug resistant TB. In 2022, new WHO guidelines has been released, that is a 6-month regimen. So when compared to 20 months, the previous regimen is of 20 months, at least 9 to 20 months. This 6-month is a treatment for choice in case of eligible patients. So this is of shorter. What is the advantage of this new treatment of tuberculosis? It is shorter duration. Then the pill burden to the patients, it is less, and its efficacy by using novel regimen, novel medicines are using, so its efficacy is more when compared to that of previous one. So previously it is 9 to 20 months we have to continuously use the medicine, but now as the statistics till 2022, it is saying that no guidelines are there which enhances the treatment or treatment potential, and which prioritized a 6-month regimen. So coming to another case is that HIV and TB. HIV and TB also has one relation. That the relation between HIV and TB is that the patients which have HIV, if they get TB, chances of lethality is more. So that is explained in this. HIV and TB, it forms a lethal combination. 60% of HIV negative patients with TB on average, and nearly all HIV positive patients with TB are dying. They will die. In 2022, as the statistics says, About 167,000 people died of HIV associated tuberculosis. The percentage of notified TB patients who has documented HIV test result in 2022 was 80%. It was 76% in 2021, which raised to 80%. So that is HIV and TB. So there is a chance for lethality, more mortality or lethality in the patients that contains or that are infected with HIV. If they are infected with TB, the chances of death or lethality is more. So coming to the important topic of today. So far we have learned about so far we have just discussed about what is TB and what are the methods, what are the main symptoms of TB, then what are the methods that can be used to diagnose TB, what are the methods that can be used for the treatment of TB, which are the first line drugs that are used, which are the second line drugs that are used, which are the novel drugs that are used. Now, coming to the role of pharmacist, we are discussing about the role of pharmacist. Actually, pharmacist has an important role in improving the accuracy of TB identification. First, I already mentioned during that screening, that is during the first slide, when the symptoms have been given, in that slide itself, I said, if a pharmacist know about the symptoms of TB, that is immense weight reduction, drastic weight reduction, then cough along with blood, then sneezing, breathlessness. These symptoms, if the patient, if the pharmacist are able to identify, then they can screen properly the patients for TB. So they can conduct cough screens on patients and refer them to good healthcare facilities for the proper diagnosis. And the second role of pharmacist in tuberculosis control is that once a patients are diagnosed, the pharmacist can provide DOT. What is DOT and what is dot therapy? Dot therapy is actually, it is directly observed treatment. So that directly observed treatment can be done by a pharmacist. What is dot, we will discuss later. So if once the screening is done, properly diagnosed, then the pharmacist can provide dot therapy. Then next, it is expected that active participation from the pharmacist in the above screening, that is for screening, for correcting the regimen, for counseling, for all these purpose, pharmacist has a role, and these all can lead to improving the accuracy of diagnosis of TB, as well as the TB drugs, the drugs that are used for TB associated with certain adverse drug reactions. So if a pharmacist was able to say that adverse drug reaction, was able to convey that adverse drug reaction to the patients, then patients will be more aware of the reactions and proper or improved treatment outcomes can be given. So that is the main role, that is the main thing about the role of pharmacist. And WHO as well as FIP has conducted a collaborative actions, that is it just made to unite the national pharmacy associations, and it implemented various plans for engaging various pharmacists to fight against this TB, or in the context of national health system and services, they just make the pharmacy association to come forward, and collaborative actions was done. And the main points of that action is that to provide joint stewardship in developing policy, that is in order to engage the pharmacist in TB care and control. WHO as well as FIB, they aim this collaborative initiative to initiate or to engage the pharmacist in TB care and control. And for this purpose, what they done was, as a first step, they understand the role of current role of and potential contribution of pharmacist in the healthcare delivery, especially in TB, what all things a pharmacist can do. So that role of pharmacist has been assessed. Assessment of that role was done, which is followed by orientation and training of pharmacists. Proper orientation in order to give dot therapy and all, proper orientation should be there, or training should be there for the pharmacist. So the training and orientation was increased. For that purpose, what WHO aimed was they aimed to give training curricula to the pharmacy students. As a result, what happens is they can update the students as well as the faculties and the pharmacists can update their current knowledge and practices in TB control as well as care. So, as a result of this initiative, next it includes the increasing awareness of tuberculosis among the common people and patients through various national TB programs, and also the pharmacist they helps in diagnosing or they helps in screening the particular disease, and they helps in explaining the treatment of this tuberculosis, referring patients with symptoms to appropriate healthcare facilitators, then supportive supervision of TB patients. For example, directly observed therapy, that is treatment, that is DOT, in order to enhance the adherence to the treatment and to reduce the multi-drug resistance. For that purpose, various collaborations have been done. So the collaborations all are aimed in order to reduce the TB, or in order to get aware the people about more about the tuberculosis. So rational use of antimicrobial medications, I mean anti-TB medications, are also the next important aspect of the collaboration was rational use of the medications. That is, the medications are supplied and the fixed dose combination that are recommended by WHO, it is used. Further, another factor is dispensing anti-TB medication the, without any certification, or safe and effective and sale of inappropriate combination of anti-TB medication has been stopped, and the sale of anti-tuberculosis drug over-the-counter drugs without the prescription, that was prohibited as a result of this collaborative initiative. Then continuous dialogue with healthcare providers, it rational the strength of TB management. Then another aim of the this collaboration was, or collaborative WHO and FIP collaborative initiative with pharmacy groups was that in order to engage pharmacists and their association to stop the TB partnership efforts in local, national, and global levels. So these all aimed to care for the care and control of the tuberculosis. Then develop and implement a system to monitor and evaluate all the programs, and documentation and sharing of experience related to role of pharmacist and evidence base of role of pharmacists for controlling this TB was given emphasis. Then coming to the important role of pharmacists in TB control, we can say they can assist in early identification of TB suspects. If a patient is coming to your pharmacy, or if you are a community pharmacist, or if you are a dispensing pharmacist, if a patient is coming with the symptoms, we can identify the symptoms and refer that patient to healthcare facilities for proper diagnosis and treatment. So that is first the pharmacist can do. The first point is screening of the patient for tuberculosis, if the patient has tuberculosis or not. The next is the pharmacist can also provide supervision, as well as they can give education, they can give proper information to the community about the rational use of medication and how the transmission of this particular disorder, that is TB, transmission of TB among the patients, how it can be controlled. For all these purposes, the pharmacist can give information, educational information, proper information. Then pharmacists can also assist other public as well as private care providers in order for the rational use of anti-tuberculosis medication. And what happens if the anti-tuberculosis medication, the rational use of anti-tuberculosis medication always aim to prevent the emergence of drug resistance. That is the main problem of TB patients. The main problem that the TB patients face is multi-drug resistance, especially resistance to isoniazid and rifampicin. So as a result, they have to shift to second line therapy, which has more ADR. So, in order to prevent this multi-drug therapy, what a pharmacist can do, in order to prevent this multi-drug resistant condition, what a pharmacist can do is educate the patients about the need for continuing the medication and to completing the course of medication, and also at the same time rational use of medications for TB. And also, a pharmacist can educate the patients about the early minor side effects that can cause as a result of administration of anti-TB medications, or late major side effects that can cause as a result of continuous use of this TB medications. So, what is dot therapy? Dot therapy is important in case of tuberculosis, and a pharmacist have an important role in providing this dot therapy. Dot therapy means it is actually directly observed therapy. It is actually a practice of observing the patient. We are directly observing the patient. They follow his or her tuberculosis medication. We are directly observing it. So national guidance, they recommended DOT as part of standard care for tuberculosis treatment. And throughout the world, this DOT therapy is followed. What should I expect during the DOT? What a patient should expect during DOT therapy? You will be paired with a DOT worker. It must be a healthcare worker. It can be a pharmacist. So you will be provided, or you will be paired with a pharmacist, and it is important to choose a time and place for your convenience, so that we cannot miss the meetings. And frequency of visit depends upon the TB medication that is used. That is, some medication every day you have to take, and some in the week only twice or thrice. So depending upon this medication, the frequency of visit will varies. Then the dot worker, they will supply you with the particular medicine and watch you swallow the dose of your prescribed medication. The dot worker also, with the dot worker you can chat about the side effects of the medication, then what can be done, or the necessity for completing the course duration of medication, then if any clinical appointments should be done, that you can discuss with the dot worker. So a pharmacist can be a dot worker, and a pharmacist can provide all the informations to the patients with TB regarding this. Next is, what are the benefits of DOT? DOT is highly associated with improved treatment success. That is, a high success is there for this DOT, because here what the DOT worker is often, or you will have many opportunity to ask different questions to the DOT worker. Or especially if it is a pharmacist or any other healthcare professional, you can ask a patient can ask his doubt regarding the treatment, the regimen, the adverse drug reactions, etc. Then this DOT, it is free of charge, and also it is patient centered. So there are so much benefits for DOT therapy. Then what is DOT required for TB treatment? We can answer is, DOT is the most effective strategy to adhere to the TB treatment. This DOT worker's job was to present when a patient takes a medication, they should be present, and they can treat by this DOT therapy. It is possible to treat latent TB infection also, because in future TB infection, if it is coming, that can be prevented by DOT therapy. So it has so much advantage. So coming to the drugs that are used and the adverse effects related to the commonly used drugs in tuberculosis, you should know. Then only you may be able to educate the people with, or provide the people with correct information. So among the drugs, isoniazid, it causes skin rash and hepatitis as ADR. Then coming to rifampicin, it causes abdominal pain, nausea, vomiting, hepatitis, then joint hepatitis, and thrombocytopenia purpura. Coming to pyrazinamide, it causes joint pain, arthralgia, and hepatitis. And streptomycin, we all know that antibiotic is related to auditory problem. So vestibular and auditory nerve damage will be there, along with renal damage. Ethambutol, it will cause ocular problems, side effects such as retrobulbar neuritis. Then if you're taking the case of thioacetone, it can cause skin rashes, dermatitis, and para-amino salicylic acid, it is associated with anorexia. So if a patient is complaining about anorexia, nausea or vomiting, we can say that it is due to para-amino salicylic acid, the dose of para-amino salicylic acid. So there is no need for worry. You can say to the patients, or you can inform the patients. So hypersensitivity reaction is also there for past the para-amino salicylic acid. Then for kanamycin, vertigo, auditory damage is there. For ethionamide, there is diarrhea as ADR, abdominal pain as ADR is there. Then headache, convulsions are dizziness are the ADR associated with cycloserine. So minor and major side effects are there. The minor side effects of TB drugs is that anorexia, nausea, abdominal pains are associated with rifampicin. Joint pain. If a patient is complaining about joint pain, then we can say that a pharmacist can educate that person by saying that it is due to the particular drug pyrazinamide that is used in the regimen. So you can use any diclofenac or any other pain relievers to get rid from the pain. So that joint pain is always associated with pyrazinamide. Then in the feet, there will be a burning sensation. It is due to isoniazid, use of isoniazid. And also some patients, they will complain about the orange or red color in urination. So a pharmacist can educate that person saying that no need of worry, it is due to the drug rifampicin. It is due to the drug rifampicin, that is your urine is orange or red color is due to presence of the drug. Then major side effects are there. If you're using streptomycin, rifampicin, and isoniazid continuously, it is associated with skin itching and rash in certain patients. And streptomycin, as we all know, continuous use can lead to deafness and also dizziness, vertigo will be there. Then isoniazid, rifampicin, and pyrazinamide also causes jaundice, vomiting. Then in the case of ethambutol, there will be visual impairment or loss of vision will be there. Journalist purpura will be there. So these are the common side effects of TB drugs. So in short, if we are saying in this TB World TB Day, the role of pharmacist, if we are explaining, we can say that the pharmacist has an immense and important role in controlling tuberculosis. Has an important role in tuberculosis care and control, starting from the screening of tuberculosis, proper screening of tuberculosis by screening by analyzing the symptoms of tuberculosis. A pharmacist can screen the patient if he has tuberculosis or not, a pharmacist can say. And after the diagnosis, a pharmacist can educate the person with the drug regimen that is used. Proper guidance can be given, which drug, when it has to be taken, and at what duration it has to be taken. The need for completing the course can be explained to the patients by a pharmacist. If the course is not completed, what is happening? If the course is not completed, then it can lead to multi-drug resistant tuberculosis. In multi-drug resistant tuberculosis, the patient will not respond to rifampicin or isoniazid. As a result, second-line drugs which has more ADR should we need to prescribe, or a prescriber needs to prescribe that drugs. So a pharmacist also can educate the patients about the rational use of medication, the correct dose, the dose of medication, correct drug use, then which time it has to be taken. All this important information a pharmacist can give to the patients. The next is a pharmacist important role was to educate the person about they educate the patient about the ADR associated with the particular drug. If a pharmacist is aware of the ADR associated with the particular TB drug, then what happens? He or she may be able to assist the patients. If the patients are coming with a complaint that their urine is orange red in color, what can be the reason? Or they have joint pain, what can be the reason? Then if a pharmacist is properly educated, then he or she knows about the area, then he can educate the society and educate the patients that are affecting with tuberculosis. So these are the important roles of pharmacist in the TB care and control. So as we all know that the importance of healthcare workers, we all know about the importance of healthcare workers, and especially the pharmacist and all the role, it becomes more evident when the COVID-19 outbreak it has been reached to us. So at that time, we have seen the role of all the healthcare workers. So here also, tuberculosis control and prevention is that we can prevent and control tuberculosis. So in this tuberculosis control and prevention, as healthcare worker, pharmacist has an important role, starting from screening, finally to educate the patients with the proper area that is occurring as a result of use of the particular tuberculosis drug. So a pharmacist has an immense as well as important role. So as pharmacists, we all can work together. We all can participate in various awareness programs and initiatives. We all can enhance our knowledge by attending various lectures related to tuberculosis, or various online videos. By gathering information from there, we can enhance the knowledge about tuberculosis. So thank you so much. In this day, World Tuberculosis Day, we all can join together and we all can participate in various awareness programs with an aim to reduce the onset of tuberculosis and control the tuberculosis. Thank you so much. Thanks for listening. If any doubts are there, you can just ask. Or shall we stop? So I'm stopping. Thank you so much for your patience and listening. Hope this session was useful to you. Please, just share your experience in the comments. Thank you so much.